Welcome to Doctors on Call. In the past few months since the new dietary guidelines came out in the United States, cholesterol has become a very controversial topic. I have patients, friends, and even my relatives ask me questions about eating ghee, cakes, and even French fries. They keep asking me, can I eat whatever I want without having to worry about cholesterol or fats? In fact, there was a recent message circulating around that stated that cholesterol does not cause blockages. Today, I'm going to help you understand what exactly is cholesterol and what you need to know to keep yourself healthy. Cholesterol is a waxy substance that is in the lining of every cell in our body. It is also essential for the proper functioning of our body as it helps make certain hormones like estrogen and testosterone, and also helps keep the nerve cells to function properly. So cholesterol is good for you, but if you have high cholesterol, especially bad cholesterol, then you have a higher risk of having blockages in the arteries of your body, increasing your risk of heart attack, strokes, and a whole host of other illnesses. Now, we get cholesterol from the food we eat, like meat, eggs, full-fat dairy products, and many other sources. But the majority of the cholesterol is actually made by our own body, and that is determined by your genetic makeup. In your body, the liver makes all the cholesterol you need and then circulates it through the blood. Dietary cholesterol itself only accounts for a small percentage of your total body cholesterol. But then this becomes important when you eat diets rich in bad fats like trans fats. This increases your cholesterol in your body, especially the bad cholesterol, and that is bad for you. So now the question is, what are fats? And what is all this hue and cry about saturated fats and trans fats? So broadly speaking, there are three different types of fats: saturated fats, unsaturated fats that include mono and polyunsaturated fats, and trans fats. Out of all the fats, these are the healthiest. In fact, in some cases, they have actually been shown to reduce heart disease overall. Oils like canola, corn, olive, soya bean, and sunflower are some of the sources. Another good source is seafoods like shrimp and fish like tuna and salmon. Saturated fats. They're not as good as unsaturated fats, but are not as bad as trans fats. They do increase the cholesterol production by the liver, but not by so much. Saturated fats are frequently found in red meat, cheese, butter, and of course ghee. The general recommendation is that less than 10% of your daily calorie requirement should be from saturated fats. Trans fats are bad fats. These fats are primarily found in processed foods that are made using oils like vanaspati. These are especially used by roadside vendors in making chola bhaturas, samosas, or pakoras. Trans fats are best eliminated from your diet. The cholesterol in your blood is of many types, but the two most important ones to understand is the bad cholesterol or LDL and the good cholesterol or HDL. Now, when you take a diet with high amounts of these bad fats or trans fats, it especially increases the bad cholesterol circulating in your blood. Excess bad cholesterol or LDL can form a plaque or blockages between the layers of your arteries. This can increase over time and increase the risk of coronary artery disease, heart attack, or stroke. The good cholesterol or the HDL, on the other hand, cleans the blood of the bad cholesterol. Trans fats reduce this good cholesterol and increase the bad cholesterol. So the key thing to understand is that if your cholesterol is high, then you need to take treatment. It is also important to reduce your trans fats because that can increase the bad cholesterol. To learn more about this, we talked to my old friend and colleague, Dr. David Davidson.
In my opinion, a healthy diet, the first thing that you actually want to focus on, in my mind, is sugar. Sugar, in my mind, is the main driving force behind the obesity and diabetes epidemics that are sweeping the globe. So if you're going to try and eliminate one thing, it's going to be sugar, and if you want to focus on healthy sugars, such as the sugars you get from fruits and certain whole grain products like oatmeal, that's okay. dietary cholesterol, which was initially thought to be one of the major drivers behind heart disease back in the 1950s and 60s, doesn't seem to play as much of a role. Those tend to not be all that bad. I think a healthy way to start your day is with a couple of eggs. And I don't think that the shellfish like shrimp and lobster need to be eliminated like once thought.
So the message to take away is this. First, cholesterol in your food is fine as long as it is in the required amount. If your blood cholesterol is high, it will cause problems. How high can your cholesterol be? Well, it varies depending on your age, risk factor, and you can talk to your doctor about it. Second, try and avoid trans fats and keep the saturated fats that include your ghee, cheese, and various other fats at less than 10% of your daily calorie requirement. But most of all, lifestyle modification is the key. Quit smoking, exercise regularly, and use your common sense. See you next week.